I'm Dr. Suvin Shetty. I'm from Mumbai, and I am a pathologist working at Dr. L.H. Hiranandani Hospital, Mumbai.
And I'm Swati from Bangalore. I'm anesthesiologist, professor in a medical college.
Okay, great. So it's a small world. I'm Kavita. I'm also an anesthesiologist. So how did you all, come and join this course? How did you decide to come here?
I realized it, apart from anesthesia, I should see the management part of it and get into the resource allocation.
I always was keen into administration. Being a pathologist and heading a department, I felt I can do much more with a better education from management perspective. So what better than BITS Pilani WILP?
Right.
So, when I decided that I must do management, and that, like he said, is we decide that doctors probably make better managers than non-doctors where healthcare is concerned.
Of course.
So why should they have all the fun?
We have to integrate healthcare with management. We can't leave out the healthcare. Being doctors, we must come forward.
So I think we understand our problems better than anybody who's not from this group. And then BITS, obviously, so from there we know that BITS is a great organization, and when I realized that BITS is offering a course,
and BITS gave us the, the platform to do work, continue work along with studies. That was a major plus point of MBA from BITS. And MBA in Hospital and Health System Management started with the first semester dealing with quantitative methods, all the statistics part, managerial economics, finance, accounting. It really gave us that confidence to face the world being doctors,
but
isn't
my
it?
best is always Professor Rajiv.
Yeah.
I love quality because as a laboratory,
and it's an integral part of
and it was very important. It's something that I could take home and could easily.
We brought in quality in our work. We introduced the quality system in our work.
No, and I wanted to do the startup, and my co-founders are from the business and the tech background. So I thought if I go into this without knowing this, I'll always be at a disadvantage. And I'm so happy with the course because in the very first term they taught us finance, the accounting, economics.
Exactly.
And so now, things are clear. So I can read my own balance sheet, create my own.
And we can do our own.
Yes.
Our own.
That's the best part.
So doctors who can read balance sheet.
Balance sheet, cash flows, we understand. Economics gave us a very good confidence.
Doctors otherwise are totally into medicine.
We
leave it to the others.
We were living in our own silos. We didn't know anything about the hospital. Now the overall hospital general, outlook we understand, and marketing. We have stepped into marketing also.
You realize that hospital is also a business. It has to run. I mean, it is not enough for us to be just good doctors. So the hospital as a business also.
We have developed an eye to it.
Has taught. I'm
as
really
a professional,
grateful.
we now tend to understand the working of each and every department, each and every facilities.
Yes.
Possibly looking at ourselves as where we place ourselves in that. Some of those conceptual like strategy management was something very, very unique, isn't it? We always had vision, but we never thought
there is some science behind it. There is actually a science behind it.
I really thank the team BITS for making this particular course valid, valuable.
I enjoyed doing the project in the third sem. I incorporated the lean system management, how to go in the lean Six Sigma in OT improvement, quality improvement, and which Rajiv Gupta sir helped me a lot. He mentored me immensely. I'm really thankful. How were your experiences?
I spoke to my mentor. I said, what should we take up as a topic? He said, let's look at patient satisfaction, the customer satisfaction. So, that was innate. What the leadership was also looking at, the satisfaction of the patient and how to improve. In fact, we are planning to do further article writing based on that. But that was something which came from the leadership, and we decided to take up that project. He being my mentor, I had to definitely go ahead and work on it.
It's helping you in your... So mine, we are a new startup and we're going into a new product. It's basically clinical follow-up. So we wanted to know what are the attitudes. So I did a knowledge attitude practice study. And the results from them were very helpful for us. It helped us in formulating our own strategy, how to go market, how to structure the business, what should we emphasize on. So all that came from there. And I'm really grateful.
So all the theoretical learning we actually put into practice and took the best part of it for moving our existing organization.
Integrated learning process.
Very true.